I'm Bob Spinozzi, and welcome to this edition of Healthy Living with Emerson Hospital. Today's show, our topic is the influenza virus. We simply call it the flu. This past flu season was particularly bad to the extent that the Center for Disease Control estimated that approximately 700,000 people were hospitalized with the flu. Well, the flu season is again on our doorstep, and we're going to discuss the virus itself and also the different ways that we can protect ourselves from getting it. And to talk about all this, it's my pleasure to have with me Emerson physician Dr. Allan Kuong. Dr. Kwang has been at Emerson Hospital for the past 9 years. Prior to that, worked at Mid-Coast Hospital in Brunswick, Maine. He was also a naval officer who served our country for 21 years and served in Iceland, Bermuda, and areas of the Persian Gulf. So let's go over to Emerson's Urgent Care at the Point in Littleton and get ready to prepare for the flu season. Dr. Kwang, thank you very much for being with me.
Pleasure to be here.
We're going to talk about flu. Let's start by talking about last year, which was a particularly bad flu season. Tell us why that happened.
Well, Bob, I would agree that the flu season was particularly bad last season, although every season I think flu is bad anyway. But in particular, for me, it was on various levels. One, working clinically in the shifts, particularly in January and February, it was we were inundated with flu cases. And in fact, we had flu cases up until the early part of June. Other reason for this was that the strain of the influenza virus was the H3N2, which is a particularly virulent strain, and this happened to occur this past season. Also, by January of 2018, if you were to look at a map of the United States, the continental U.S., simultaneously all parts of the U.S. had influenza cases that were confirmed. So this was a particularly bad season.
You know, when we talk about the flu season now, most of us think of it being fall and wintertime, but in fact, is it even longer than that?
Well, typically it is fall and winter time. I had heard that there was even a summer strain, although we did not see that, although we did see some flu-like symptoms that were similar to that, but generally speaking, fall and winter.
Okay. Now, typically, I get my flu shot at Emerson's Westford Internal Medicine. Will you have the flu shot available here in Littleton Urgent Care and also the Hudson Urgent Care facility?
Absolutely. We will have the flu vaccine available. In addition, the flu, high-dose flu called Flu Zone for those 65 years of age and older.
Okay, now, obviously this is an urgent care center and getting a flu shot is not an urgent care situation. Can you make a separate appointment to get your flu shot, or is it strictly a walk-in situation?
You can make an appointment. We are both a walk-in and appointment basis here at Urgent Care.
Okay. Now, we have the flu and we have the common cold. And there are a lot of symptoms that are similar, if I'm not mistaken: headache, muscle ache, sore throat. But can you tell us any of the differences between the two that we should watch out for?
Right. There are some similarities, and I will point you to the CDC website, which depicts the differences between the flu and the cold. A lot of them have similarities. However, it seems that the flu, fever is probably more present. It's more of an acute onset rather than gradual onset with the cold. The symptoms appear more severe with the flu: sore throat, cough, feeling very malaised. The muscles seem to ache tremendously. And in fact, when I see the patient, when I'm trying to decide that, I actually end up the conversation with asking them, do you feel like you've been hit by a truck? Not that I've been hit by a truck, but universally, people just identify with that and they say yes. And when they say that, pretty much I have a good idea that they likely have the flu.
So it probably makes sense to have a thermometer at home to check your temperature.
Absolutely. Mm-hmm.
Now, some people don't get the flu shot. They just don't get it. But exactly how critical, in your opinion, is it to get a flu shot?
I think it's absolutely critical. Unless you have some sort of contraindication or your physician has mentioned not to take the flu shot, you should get that. And it's on various levels. Probably half the people I saw in the clinic did not get their flu shot. Invariably, they'd say they either forgot, they didn't have time, or they said, every time I get the flu shot, I get the flu, which is erroneous. But in addition, even though the flu vaccine may not prevent that actual strain that has been predicted for the previous year, it'll still protect against other strains that are present too, including influenza B.
Now, at the point that you've gotten the flu shot, how long does it take? How many days or weeks does it take for it to become effective?
Good question. So generally speaking, it takes 2 weeks for antibodies to develop.
Okay.
Okay.
Now, in addition to getting a flu shot, we can do common sense things like washing our hands all the time and not putting our hands up to our face. What are some of the other things that we can do to help not get a cold or the flu this year?
Right, great question. Well, number one is always doing hand washing, which you should do anyway, but particularly during the flu season. Number two, having that box of Kleenex tissues, using that, but also not just letting them pile up on the table where someone else can have access to them. Throw them right away. Three, if you're to sneeze, some people say don't sneeze in the air. Maybe sneezing as if like into your elbow like this. That way you're not even using your hand, because your hand, of course, touches a lot of surfaces. And speaking of surfaces, you want to sort of wipe down all these hard surfaces, doorknobs, telephones, what have you, because the virus can remain active for 24 hours or further out. So it's very important to clean those surfaces.
All the obvious things, the TV remote, anything that you touch, or other people touch.
Yes. The other thing is also to remain very hydrated, getting a good amount of sleep, eating right, exercising, and just trying to stay healthy. And a lot of these recommendations that we say for the flu really can be applied to just your general overall health, which one should do just on a daily basis. And then if you are really sick, some people advocate doing vitamin C and vitamin D and zinc.
Okay. Now, I know that Littleton Urgent Care and Hudson Urgent Care are open virtually every day except for a couple of holidays, so you can get a flu shot any day.
Yes, that's correct. Yeah, we're open Monday through Friday, 8 to 8, and then Saturday, Sunday from 9 to 5.
Okay, very good. Well, thank you very much for all that information.
Thank you, Bob.
Dr. Kwang told me that he also serves as a reserve patrol officer and tactical physician for several Maine police departments. Well, that's all I have for you today. Wait, there's one other thing. LCTV's Kirby Dolak got a flu shot while we were at the Littleton Urgent Care. So let's watch that.
Perfect. All right. Hi, my name's Laura. I'm going to give you a flu shot today.
Okay, is it going to hurt?
No, it
Okay.
should not hurt. So I'm
All
just
right.
going to clean the area.
All right.
You can just relax your arm right to the side.
Okay.
Perfect. Here we go. How you doing? Okay?
Doing great.
Perfect.
That didn't hurt at all.
Good.
That didn't hurt at all.
Just put a little Band-Aid on it,
Okay.
and then you'll be all set.
Good. Again, I didn't know I could get the flu shot here, so that's great.
Nice and easy.
Very easy. Didn't have to wait.
Yes. Excellent. There you go.
Thank
You're
you
all
very
set
much.
to go. If you have any questions, give us a call.
Okay, good. Thank you.
You're welcome.